As we try to link families and children who have been affected by prenatal alcohol exposure to healthcare systems, the only way it's going to work is through a system that a family can flow through from beginning to end, a very structured system. Some of the work we're doing is within community health centers, and we have some very exciting work going on in some of our centers where we have implemented universal screening, so every pregnant woman gets screened with the 4Ps Plus for alcohol use during pregnancy. Any woman with the positive screen, that information is communicated to the pediatrician, who then knows that the child was prenatally exposed and can do an appropriate assessment of the child. And then every child gets an ASQ on repeated bases, so that if the Ages and Stages questionnaire and the Ages and Stages questionnaire social emotional, so it's the ASQ and the ASQSE, so if the pediatrician knows that the child was prenatally exposed to alcohol, and over the first 5 years of life begins to show developmental difficulties or relational or social emotional difficulties on the ASQ, then can be referred immediately into a specialty clinic that can really evaluate the child further. The most difficult aspect of doing this, however, was crossing the placenta. That is, moving information from the prenatal care providers to the child care providers. And it doesn't make a whole lot of sense, but people used excuses like HIPAA, confidentiality, but only as you work through those systems, and it's all very workable, but once you work through those systems, you have a flow of information that in the end really benefits the child and the family. So community health centers are a great place to attempt this kind of work because it's a closed system. And so at this point, we have systems of care in place in which prenatal information with universal alcohol screening is communicated to the child's health side. So when the child is born, from the very beginning, the pediatrician knows this is a child who is at risk because of prenatal alcohol exposure and can follow that child with repeated developmental screens that will guide the child into treatment, assessment and treatment as necessary.